What initially attracted you to the LDM Triple?
To be honest, I really wasn't interested in any devices. I've got lots in the clinic and I feel I can address most things. But what really appealed to me about the LDM Triple was that it really did strike me as something different, because that's what every salesperson is going to tell you. This is different, this is cutting edge, this is revolutionary. But it really did sit outside of anything else that I had in my clinic. And when you delve into the science, you can see why that's true.
And what was your experience using it over the last 12 months?
My experience of using it over the last 12 months has been quite eye-opening, really. We didn't just jump in and just start treating willy-nilly. We got case studies in, we looked at the common theme, I think, was inflammation, and we have to think about inflammation anyway. So we were treating people with eczema, with acne, with facial psoriasis, but also people for simple anti-aging, just smart, intelligent aging. And the results were really interesting. What we found is that sometimes people can, even within one session, show some really powerful results. We've seen that on some of our acne cases with inflammation coming down. But then with others, to see the real wow results, you can sometimes have to wait some months after you finish the course. So I think patience is the key, but the results are just absolutely incredible. And
what have you seen in your patients and the types of concerns you found it particularly useful for?
What we've seen in the people we've treated is that those with any kind of visible inflammation or a problem where inflammation is part of it, like acne, for example, is that we see that inflammation coming down quite quickly in most cases, sometimes within one session. And also that, the patient experience is just perfect. That no pain, no downtime, no issues whatsoever. It's just a very simple treatment. I'm not going to lose any sleep over doing it. And the likely outcome is a benefit to the patient, often where there are very few options, if any, that you can actually offer them.
Okay. What do your patients say about the treatment experience?
Patients report a perfect patient experience, really. I mean, they actually love the treatment. It's pleasant. You start off feeling very little, and then you can get a very slight warmth, sometimes a very, very subtle tingle, but nothing remotely unpleasant. I mean, they actually say they really enjoy having it done, and it feels just like a very relaxing treatment. But the incredible thing is that it's delivering this triple frequency ultrasound and doing these amazing things in the skin, but they love it at the same time. No downtime, and so you can ask for more. Really.
Where do you see LDM fitting alongside other treatments and technologies?
I believe LDM Triple has a place alongside pretty much everything that you have in clinic, because when you delve into the science of how it works, through caveolin 1 and the DWAT layer, you can see that this is a bit like how I liken GF5 with cell derma. This is about signaling. This is about multiple cascades, influencing multiple cascades of repair regeneration. So really, where could that not fit in? Where would that not have a benefit? And the more we understand about, preparing tissue for treatments, helping expedite healing or improving the outcomes that you're going to get from any other treatment, you can see it fits into pretty much anything. And as I say, so often where people don't have anything to turn to for whatever reason, contraindications or safety concerns, whatever, they can't have other treatments, LDM Triple almost always is a tick and something you can offer them, which is really nice because it's hard to say no to someone.
Would you recommend LDM Triple to other doctors or clinics, and why?
I absolutely would recommend LDM Triple to other clinics but I think it really is going to align more with people who can think outside the box, because it does sit a little bit separate to most other devices that we know, which often work through thermal microinjury and then triggering collagen elastin production, etc. This works differently, and I invite people to really delve into the science, read some of the papers, meet people from the team, and then you'll have a real appreciation of the wonder of what this technology offers. So you can then talk about it passionately to your patients and believe in it.